Your back hurts. You Google lower back pain and you start exercising like crazy. However, there are a few things you should know before you begin. In today's episode, we'll debunk 5 most popular myths about lower back pain. My name is Kate, I'm a physical therapist, and welcome to my channel. Myth number 1, lower back pain is always related to the spine. No, it's not true, and in my opinion, it is the most dangerous myth about lower back pain. We talk about LBP when we feel pain between lower ribs and the buttocks, and in most cases, it actually comes from the spine and its associated tissues like ligaments and muscles. However, lower back pain can also be caused by liver, kidneys, pancreas, colon, rectum, diseases of female and male reproductive system, and this is not the end of the list. Therefore, each lower back pain requires differential diagnosis. Because if you misdiagnose yourself without consulting your lower back pain with your doctor, you can only make things worse. For example, you may have a duodenal cancer that makes your back ache. You will start exercising intensively and you will only improve the trophic conditions for faster cancer development. So please remember, lower back pain does not always come from the spine. Myth number 2, all exercises are good for the spine. No, they are not. Internet is full of exercises suggestions. Mostly these are videos like heal your spine in 5 minutes, or do these 3 simple exercises to get rid of your lower back pain. And I need to tell you that I am very entertained by such films because these are usually typical clickbaits recorded by people with no medical backgrounds. In practice, each spine disease requires different therapeutic approach. For example, we will use different exercises in L4, L5 disc herniation and different exercises in L4, L5 spondylolisthesis. What will bring relief in discopathy can worsen the symptoms in spondylolisthesis and vice versa. And unfortunately, I have many patients who have worsened their health due to random internet exercises. So please remember, in lower back pain, there is no one-fits-all therapy. Myth number 3, with lower back pain, you should rest a lot. False. Most guidelines for LBP recommend avoiding bed rest with lower back pain. Why? In a nutshell, our spine is designed to move. Even if it is injured, it should be able to receive variable loads. This is extremely important in the case of damage to the intervertebral disc, which needs compression and decompression to regenerate. If you lie in bed for many days, you do not subject your spine to changing pressures, which means that the intervertebral disc is not properly nourished by the processes of diffusion and osmosis. Also, if you stay in bed for many days, you laze your muscles, you laze your ligaments, and as a result, you delay your recovery. So with lower back pain, you should stay in bed for 1-2 days, but not more. Myth number 4, my favorite one. Lower back pain will be stronger when you get older. No, it's exactly the opposite. All the data show that we experience back pain most often around the age of 30, 40 and 50. The older we get, the less pain we get. Why? Because our body is smart. If our spine is injured, our body produces degenerative changes around it, which will limit the mobility of the spine, but on the other hand, reduce the pain. That is why the elderly around 70s, 80s have a lot of degeneration in their spines, but their spine rarely hurts. Myth number 5, the more changes in MRI, the more pain and disability. No, it's not true. Let's say you did an MRI and you get the result, and you can read degenerative changes, disc herniations, foraminal stenosis, osteophytes, a lot of scary words you don't understand. The first thing that comes to your mind is no hope for me. Meanwhile, it turns out that you may have very damaged spine in the result of MRI and do not feel much pain. In fact, many patients find about their spine degeneration completely by accident while performing some other examination. Today we know that MRI changes do not correlate with pain intensity, depressive and anxiety syndromes, or quality of life in patients with lower back pain. Therefore, if you receive your MRI result and there is a lot of text over there, don't be upset. It doesn't mean that you will need to live in pain or need to do a surgery. Okay, that will be all. Thanks for watching and see you next time.